Okay, next my lecture is early brain development, and in the first trimester, of course, it is very difficult to detect the brain abnormality in the first trimester because as I told you and as Ravi told that the brain development is through the pregnancy, and sometimes even after the pregnancy, the brain is developing. And of course, in your brain, the brain tissue is now, the damaging day by day. But the fetus and the neonates, their brain is developing all the time. And in the first trimester, this is the computer graphic of the small brain. And this is the embryo between the Carnegie stage 13 and 23. And during those stage, the brain is developed very remarkably. And first, this is the small embryo on the surface of the yolk sac. And the upper one is those are the real fetus embryo, and the lower figures are computer graphic. And this is the stage 13, 16, 19, and 23. This is a computer graphic by the Kyoto University group, by Professor Kohei Shiota in Japan. And they have the great correction of the small embryos. And nowadays it is very difficult to get the small embryo because of the law, and it is very strict. But the old days, they could collect the fetuses, after the abortion, spontaneous abortion, or termination of the pregnancy. And so they have the big correction of the fetuses after birth, after termination. And this is stage 13, 16, 19, and 23. And the nervous system is gray ones. This is the central nervous system, and it is the very short period, but the appearance of the brain is completely different between the 13 and 23. And this is a small embryo at 8 weeks of gestational age. And then, you can see that this small embryo has an umbilical hernia. This is the normal phenomenon. And there's a rim bud here, and eyes and nose, and the inside of the skull. Still, skull is not ossified, but there's a brain. And I use the 3D ultrasound in early pregnancy, and as well as second and third trimester, for looking at the fetal brain. And this is a small brain. Probably, the last time, I showed this, and the 6 weeks of gestation, and those are the 3D orthogonal view. This is I'm not sure that this is sagittal, but this is the actual section. And here, this is the yolk sac, and on the surface of the yolk sac, there is the embryo, and here is the embryo on the yolk sac, and on the small embryo, there is the neural tube on the back of the small embryo. This embryo's CRL is 5.5 millimeter, and here this is the 8 weeks and 4 days of gestation, and this is the real embryo after the spontaneous abortion at 8 weeks of gestation, and you can see that this thick one is the spinal cord. And by 3D ultrasound inside of the utero, you can see the thick spinal cord. And also, this is the 9 weeks and 2 days. The spinal cord is very thin. It appears the thinner, smaller. No, that this is the because of according to the development of the vertebra. You can see the spinal cord is a linear line. And this is the three comparison between the 6 weeks, 8 weeks, and 9 weeks of gestation. And this is on the top page, front page of the American Journal of OBGYN this year, the first issue. Now, this is the MRI. This is the experimental MRI after the spontaneous abortion. And here you can see, the very clear appearance of the central nervous system. And you can see the rhomboencephalon, mesencephalon, and telencephalon. And also, you can see the spine and the spinal cord here. And how about the ultrasound? This is the 7 weeks of gestation, 3D, 3 orthogonal view, and this is tomographic ultrasound imaging. And I think, the fetus is very small, and so, I don't use usually, the VCI. And this is the normal cutting section of the tomographic ultrasound imaging. And here you can see the forebrain and midbrain and hindbrain. And it is nicely demonstrated by 3D ultrasound. And this is the comparison between the ultrasound and the experimental MRI. And you can see, this is, still, MRI is more clear. And but the ultrasound is going to approach, and this is not the VCI. This is the thick brain of the 3D ultrasound, and you can see the ventricular system here, and here you can see the right and left hemisphere. The separation of the right and left hemispheres at the end of 8 weeks of gestation. But still, the posterior fossa is very clearly dilated. And this is also the comparison between the transvaginal sonography and the MR microscopy. Now, 9 weeks of gestation, ultrasound and MRI. And this is the comparison among the 8 weeks, the beginning of the 8 weeks. This is the end of 8 weeks, and 9 weeks and 10 weeks of gestation. And just, between the 8 and 10 weeks of gestation, 2 weeks interval, the appearance of the brain is completely different among those. And after that, this is 11, I'm sorry, this is very small, and but the tomographic ultrasound imaging of the sagittal, axial, and the coronal sections. And, still, at 11 weeks of gestation, the choroid plexus is here, in the most of the ventricular system. And this is the 14 weeks of gestation. This is very clear. The choroid plexus is here, and usually, you may look at the brain in the axial cutting section, right? And so, the bilateral usually symmetrical, sometimes asymmetrical, but that is within normal limit, and the corpus callosum like this. Not corpus callosum. This is the choroid plexus, and this is the VCI at 14 weeks of gestation, and 14 weeks and 5 days, and VCI you can see the carving and of the surface of the brain and the vertebra and the spinal cord is demonstrated very clearly. And the small embryonal vasculature, this is the small brain vasculature at 10 weeks of gestation. This is already, demonstrated in 1996, more than 15 years ago. And by Kara Doppler. And also, 1996, you can see this is the mesocerebral arteries and the internal carotid arteries, and you can see the, this is the heart, and then, you can see the brain vasculature. And this is 7 weeks of gestation. Nowadays, you can see the very, very small embryo. Inside of the embryo, you can see the very premature brain vasculature. And 12 weeks of gestation, you can see the sacral release. And 14 weeks of gestation, you can see, this is the original, the vasculature of the brain. And it is a very premature, but you may understand the structure of the brain vasculature at 14 weeks of gestation. And in the first trimester, the congenital anomalies is not so many, especially in the central nervous system. And of course, this is the most typical one, acrania, and sometimes acrania with the spina bifida, upper spina bifida. And the acranial fetus has the many types of the brain structure. Sometimes the Mickey Mouse like, and sometimes the very wide, and the inside of that the only lateral ventricle with the water. And this case is at 12 weeks of gestation. You can see this is the profile. Probably you say that this is normal. Of course not. This is the abnormal profile. What is this? What do you think this? Acrania? First, I thought this is acrania. As I told you, acrania has many types. But here you can see this is the same time, the 12 weeks of gestation. You can see, yeah, holoprosencephaly, and 10 days later, you can see here, this is the eyeballs, two eyeballs, two cross, okay? And then, this is the facial abnormality. It is understandable, because, this baby has the holoprosencephaly. But, here, this is 14 weeks and 1 day. Here, what is this? Proboscis? Actually, here, can you see that? There's a two nostril-like appearance. But, there's no nostril, no tube inside. And then, it might be the very small mouth. Okay, so what is this? Okay, and go to the 3D ultrasound, and here, there is, here there is the cranial bones here, and outside of the cranial bones, there is the brain. Okay, but this baby is not, called as a crania, because there is a cranial bones. So this is the exencephaly. Okay, so this baby has the complicated with holoprosencephaly and exencephaly. So that is very difficult, and the face is very abnormal and very odd. I couldn't tell the exact facial abnormality to the mother, because the mother was so sad, to hear that, there is a brain abnormality at that time. And so, I have the one patient, who had the holoprosencephaly with a very, very abnormal, strange, odd face. And then, but I believe usually, the science, we have to be honest to the science, and I have to honestly, tell everything to the patient, but it is not correct. And that patient with the baby with a very abnormal face, she cannot accept, in the rest of the full life, and she never have another baby. And so, this case, I was so prudent to say what is going on. This is the brain abnormality, not the facial abnormality, I said. And so sometimes, we have to think that, the psychological situation of the mother. And so, I said about the face to the grandmother of the fetus, and then, please take care of the mother of the fetus at the delivery, to not to show the baby's face. Now, this is a cephalo cell at 12 weeks of gestation. This is not the exencephaly, because here you can see there is the cyst here, and this is a cyst, okay? But there's no brain tissue inside. Brain is inside of the skull, okay? So, this is a cephalo cell, only the water, with the unknown cause, 2 weeks later, this cephalo cell disappeared completely. And so, we did the microarray in this case, but, there was no known cause in this cephalo cell. But, lastly, they have the very healthy baby. And this is the baby with at 11 weeks of gestation. Here, you can see the very cute baby here. But here, at the 11 weeks of gestation, the posterior fossa is open, the widely. And this is, the comparison between the normal and the abnormal. And this baby is going to the agenesis of the vermis of the vermis of the cerebellum, yes, cerebellum. And but this baby was died in utero at 19 weeks of gestation, and so there's no further abnormal investigation in this case. Now, the facial abnormality, the face is closely associated with the brain abnormality. And so, you have to look at the baby's face, from the first trimester. And now, this is the 12 weeks of gestation. Here, you can see bilateral cleft lip in this case. And sometimes, this case, this is another case. This case, by 3D ultrasound, 4D ultrasound, it may be the cute baby, right? But, here, what do you think? Huh? Is it the typical Japanese? Joe is conspicuous, right? But why? Hypoplasia of the maxilla? Hypoplasia maxilla sometimes seen in Downs. And then because, this baby has the cleft lip and palate, and also, this baby was trisomy 21. And sometimes, every day, I look at the early fetus between 11 and 13 weeks of gestation, sometimes 20 fetuses a day. And then, the 20, 30. And so, sometimes, I look at the fetus and, oh, this is the Down syndrome-like profile. And, this is also, this baby has uh, the Down's baby's profile. And sometimes, that we look at the inside of the cleft, inside of the mouth, and you can see, this is not sure, I'm not sure yet, but, sometimes, there is a abnormal line of the palate, and this might be the cleft palate. And this is the bony structure, and I looked at sometimes, the maximum mold, the fetal face, and this is a cleft palate associated with the haloprosencephaly at 14 weeks of gestation. And sometimes, here, what is this? This is the baby. What? Micrognathia. Yeah, nuclear translucence is not so, it's a little bit increased, but not so severe one. And the micrognathia, and can you notice? Oh, you are so high level. Maxilla is absent. Right. This is the baby. And this is usually, you look at the baby like this, in the systole, mid-systole section. And here, because, you measure the facial angle. Yes. Okay, so how can you measure the facial angle in this baby? It is impossible. And then, you can notice that, the maxilla is missing. Why? Because of the cleft palate, right? And so, this is the abnormal, the bilateral cleft lip and palate in the 12 weeks of gestation. Okay? And, sometimes, the micrognathia, like this, micrognathia with low set ears can be found by 3D ultrasound. The low set ears in the first trimester is a bit difficult. But sometimes the micrognathia and the low set ears are the commonly associated each other. And also, sometimes, the congenital cataract, this is the 2D ultrasound, this is the 3D ultrasound reconstructed image. And you can see the congenital cataract here. And not only congenital cataract, this baby has the small eyeballs. Okay? And that is associated with the haloprosencephaly also. And this is also another baby, with the haloprosencephaly. What is this? Proboscis, yes. Now, the vertebral abnormality, the vertebra is, developed from the cervical region to the upper and lower, like a zipper. And, this is a spina bifida at 9 weeks of gestation. And this is the 11 weeks, sorry, two first. And this is the 9 weeks of gestation. You can see the spina bifida here. And this is another case, 11 weeks of gestation in encephaly. At CRL is 2.5, very small, smaller than the gestational age. 9 weeks is compatible. And you can see the abnormal head position and the very short stature. And also, this baby has a very abnormal reverse aortic arch flow and the reverse umbilical arch flow, artery flow. And this is another baby at 14 weeks of gestation. And you can see, this is the hydrops fetalis, uh, the cystic hygroma and ascites here and general edema. But those are spontaneously disappearing during the several weeks. But this baby has a very abnormal stature positioning here, and you can see this is the bony structure, and this is the very rare type of the trisomy 21. And this is another baby. This is the 13 weeks of gestation. The nuclear is 1.87. It is within normal limit. And you may say that small nasal bone, and the micrognathia, okay? And this baby has the mild wrist contracture and the small omphalos cell. So what do you suspect? 18, right? And then, so what is this? Can you see? Usually scoliosis. Yeah, scoliosis, but not the curved one. This is very sharp. And this baby has a fused traffic vertebral body here. This is a line, the one line. But here in the lumbar part, you can see this is the divided into several parts, right? But usually, you can see the dot, the many of the dots, from the cervical, thoracic, and the lumbar. But the thoracic vertebral body is the uniform, the one, the longer bone. Okay, and sometimes this is still ongoing baby. This is the might be the human tail. It is but sometimes this kind of the baby, the human tail is disappearing during the pregnancy. But sometimes the human this is not the sometimes this is the spina bifida, the very lower part of the spina bifida, and sometimes not. But this is the very big the human tail like appearance. Now the limb is also the closely related to the brain, and here you can see, sorry, here you can see the polydactyly associated with the holoprosencephaly. So I have the many of the holoprosencephaly cases in the first trimester, but the many of the cases may died in utero in the early second trimester. So the usually second trimester, third trimester, of course, you may come across the holoprosencephaly case, but not like the number in the first trimester. The first trimester you may have the many of the holoprosencephaly. And then, this is the, at 14 weeks of gestation, this is a polydactyly, this sixth finger is going to outside, but this is going to the inside. This is the different type, but anyway, right and left bilateral polydactyly. And this case also the holoprosencephaly, and here syndactyly, yes, and the polydactyly also. Okay, and many of the cases with not a single finding, but the holoprosencephaly with the polydactyly, they are most of them are trisomy 13. But trisomy 13 has a variety, the many variety, sometimes, the no holoprosencephaly, the normal looking of the brain with only, the small polydactyly, the amniocentesis or, the CVS shows the trisomy 13. And sometimes, the crab foot is also associated. Sometimes, sometimes it is single findings, but sometimes within the syndromic, and sometimes with the karyotype abnormality, and sometimes associated with the spina bifida. Now, in the first trimester, the sonoembryology, I said the sonoembryology, this term was created by Professor Takeuchi, and later on, the Professor Ilan Timotrich used the sonoembryology. Sonology plus embryology. In the first trimester, the 2D and the 3D ultrasound has enabled more and more accurate and objective prenatal diagnosis in the first trimester. And now, prenatal diagnosis of the fetal abnormalities has shifted from the second trimester to the first trimester. The only dilemma is the brain abnormality. Brain abnormality can not be shifted to the first trimester because the first trimester still the brain is too young, and so in the second trimester, early second trimester to the late second trimester, the brain is developed so remarkably. So we cannot detect the brain abnormality unfortunately in the first trimester, instead of the acrania or holopros encephaly or some more conspicuous ones. Thank you very much.